So one of the things that I do here at Will Vision now is run our dry eye spa for meibomian gland dysfunction. This is a chronic dry eye situation, and many people struggle with dry eye. Many of them don't even know it because it's something that comes on slowly, and they don't recognize till they've had a treatment how dry their eyes were because they forgot what it felt like not to have dry eyes. They're used to feeling that feeling of dry eyes. We also feel that there's an epidemic coming on with millennials. And the reason is they are so focused on that screen. Particularly your gamers have trained themselves not to blink. If they blink, they die. It's a very bad thing. So they don't blink. The only way that we squeeze the oils out of our meibomian glands, which are in the upper and lower lids of our eyes, is by squeezing the eyes closed. That muscle then squeezes those oils out. Those oils mix with the tears, and that creates a film on the surface that affects our actual vision. So it's not just that scratchy, dry feeling. It actually affects the vision that you have. So we here at Will Vision have opened a dry eye spa for the correction or reduction of dry eye for our patients, and we take patients that just call for that. It's a series of treatments as well as nutritional changes as well as products that they use that help improve this. And we are seeing really cool results with this. Patients that are really excited when they come back. They feel better, they're starting to function better, they're just finding it so exciting that they are empowered. It is a partnership between us and them. I can't do a treatment and cure them, and I need them to do their part. And some of this is very simple things like drinking more water. We're talking 100 fluid ounces a day, but drinking more water. Doing eye exercises of squeezing those muscles so that we are squeezing those oils out. Using the heated iPad that we have available for them that extends the effects of my treatments when they're here. Their treatments are 10 minutes per eye. Very simple, very straightforward, pretty relaxing in a massage chair, and then we have a brochure that outlines exactly what they need to do, and we partner together. We see them over a 6-week period, and then there's an extended maintenance program as well. So often patients will come from other centers, having had other procedures, or come back for an enhancement later in their lives and want to tweak it just to get it perfect, and they will be struggling with dry eyes, and they will be referred to the dry eye clinic, and we can make a difference in their life. These are simple steps that they will take over a period of time that can make a real difference and improve their vision. Not just dry eye, but their actual vision is improved by following these simple steps. The oils in the glands go from an olive oil consistency to a Crisco oil or butter consistency, and at that consistency, they're not moving. So my procedure warms and massages and moves those oils. I can actually see the oils in the ultrasound gel that I use during the procedure, and the heated iPad keeps those oils softer, extending the effects. This changes the body. So the meibomian glands can't be recreated once they have deteriorated and stunted, so they get short and they don't function as well. They're not going to come back. But the ones that are there, we can keep healthy, and that's our goal, is to use what's there to the best of our ability. In addition to the treatment, we can actually scan and view them. We have technology available here that will scan and view those glands so that we can show you what they look like. Another very common thing, we videotape you, and we can show how many times you're actually blinking where you're closing your eye all the way. Because Dr. Will was 7 out of 10 blinks he was not closing all the way. And that's very, very common. We have trained ourselves, because we're looking at that iPhone, because we're looking at that computer screen, not to blink. Often for dry eyes, they'll put plugs in the tear ducts, which makes no sense, but you're plugging the drain, not the input.
Right.
So that the liquid doesn't drain out of the eyes and stays there for the eyes. But the tear duct and the meibomian gland oils that mix will actually look like oil on water.
Right.
And when we video this, you can actually see it on the surface. And by the colors there, we know the thickness and the quality